for our educational seminars. My name is Julissa. I'm the medical esthetician here, and I'm also the patient care coordinator. So throughout your visit here, you'll be in constant contact with myself and Ashley Marie, as well as Danielle, who's Dr. Morwood's medical assistant. My role here is to help your skin get up to par and ready for any procedures, and as well to help you recover quickly and a little faster from any procedures that I work with on you with Dr. Morwood. We're here for you guys. If you guys have questions, anything at all, we are here to help you guys and answer any of those questions at any time. After the seminar, we'll be getting your names and information, and we'll be giving you our contacts as well. So if you have any questions, you can feel free to call us. Without any further ado, I'd like to present to you Dr. Morwood.
This is part of a series called The Truth About Plastic Surgery. We started this some years ago, primarily for people in the beauty industry, but we've expanded it to welcome the general public, primarily because of demand. And of course, as I said, it's called The Truth About Plastic Surgery. We do a series. One is about eyelids, one's about body contouring, one is about breast surgery, one is about plastic surgery for men, etc. So today we're going to focus on neck rejuvenation and the natural neck lift. What I'd like to do is start by talking to you about what the natural neck lift is, a system of analysis, and then we're going to go through the slides and I'm going to talk to you about how we do those things that I'm going to discuss. First of all, I think more and more people are getting neck rejuvenation and neck lifts as opposed to facelifts. I'm not sure why that is, but a lot of people just don't want facelifts, and there's a lot of people who really need a neck lift and not a facelift, especially men, lots of women, and for sure the neck, jaw, and chin, it's really the foundation for a beautiful face. It really starts with the foundation. It's a lot like building a house. We need a very strong foundation. So what I find is a crisp, clean neckline, jawline, and chin really serves as a foundation for the rest of the face. And more people seem to be coming in for neck rejuvenation as opposed to facial rejuvenation. So, high quality, safe, effective plastic surgery starts with an effective, accurate knowledge of the anatomy. So what I like to do in the office is help design a custom designed approach for everyone. Not everyone gets the same thing. In fact, people get dramatically different approaches to neck rejuvenation and of course facial rejuvenation. You know, you can go on the internet and you'll see advertisements in the media for, you get in line and you have this magic lift and this light action and this, and you sort of get in line and everybody gets the same thing. In fact, I've seen some of the weekend educational programs that they offer doctors to do those things, and they're actually template approaches, like you get a template to lay on someone's face, etc., to do a procedure this way. I'm a believer in custom designed approach. Everybody ages differently, everybody needs a different approach. So custom designed approach, you're going to hear that a few times. So, high quality, safe, effective plastic surgery starts with an accurate knowledge of the anatomy. So the natural neck lift is really a system of analysis where we go through the anatomy step by step, layer by layer. I talk to people about what they want. The visit in the office, your consultation after you meet my wonderful staff and spend some time, you'll sit with me and I'll ask you to look in a mirror and describe to me what it is that you'd want to change. So, the first layer that we look at, of course, is the skin. Julissa is our wonderful esthetician. Many of you probably have heard of or are familiar with lasers, skincare, peels. I'm a big believer in skincare. I think laser has its role. Peels certainly can be very effective. You hear a lot about that skin treatment for the face and not so much for the neck. Now, why is that? The neck skin is actually different than the facial skin. There's a relative paucity or shortage of pilosebaceous glands, appendages in the neck. In other words, the face has more oil-producing glands, sebum-producing glands, more hair, etc. So those glands and appendages are much more dense in the face than in the neck. So any skin rejuvenation in the neck has to be done very judiciously, very carefully. Now, it does not mean that we should not do any. In fact, we do like to encourage proper skin care for the neck, but we need to approach it very judiciously. And of course, it's the epidermis on top of the dermis throughout the entire body. The epidermis is what we see, the very top layer, but it's very interesting that the very top layer of the epidermis is not even living. It's the keratin layer. And so part of what Hulisa teaches people to do is to exfoliate, and oftentimes we want to thin out that layer that's not living, because when it gets too thick, there's oftentimes a dull appearance to the skin. So, and we can go through the important steps to skin care, of course. There's exfoliation, as I mentioned. There's properly washing your skin. You need to learn how to do that. There's regeneration. We encourage the basal cell, the baby cells, the factory layer, the germinal matrix, to churn extra and work overtime. And of course, to properly moisturize is very important. Lots of people think that they have wrinkly skin, but it's really dry skin. So, number one layer is the skin, and we need to look at that whether it's the face or the neck. We go one layer deeper and we look at the fat layer. Throughout the body, almost every part of the body, there's the epidermis and dermis on top of a layer of fat. That's the subcutaneous tissue, that's the subcutaneous fat. That's the layer that we go off after when we do liposuction. And I'm going to show you some cases where the natural neck lift was accomplished just by liposuction. And in the right person, for the right patient, the right customer or client, it can be very effective. If we go one layer deeper, that's the platysma muscle. If any of you ride horses, you may know what the platysma is. We have a platysma muscle, of course. It starts at our mandible, just like it does in the horse. You know, picture the horse has a very large jaw, a large mandible. And it goes 3/4 of the way down the body. It's the muscle that allows the horse to shiver. In our species, of course, vestigial. It's like the appendix. It has no other use apart to give plastic surgeons work. So when that muscle becomes lax, we need to address that, and that's called a platysmoplasty. So platysmoplasty, and there are a number of ways we can do a platysmoplasty. Submental approach, lateral approach, etc. But what that means is we're affecting the platysma muscle. Now certainly there is a layer of fat under the platysma, but there are also some very important structures under the platysma. So we need to be very careful. Typically, if I want to mold, sculpt, and tailor the fat under the platysma muscle, I need to do that under direct vision. There are some important nerves, as you all know, some important nerves and vessels and salivary glands in the neck, and those are primarily below the platysma muscle. And I'm not a big advocate of just bluntly or blindly suctioning that layer, because we need to be careful. There are some very vital structures. So once I look at the skin, the texture and the topical issues of the skin, we can also look at the amount of skin. And is there too much skin? Does it need to be repositioned? Does it need to be firmed up? And these are components of what we call the natural neck lift, because it starts with an assessment. We need to do proper analysis and go layer by layer. So we look at the texture of the skin, then we look at the skin itself. Is there too much there? Is it stretched out? Has it lost its resilience? Then we look at the fat layer underneath the skin. Then we look at the platysma muscle. Then finally, we look at the foundation. Sometimes we can actually affect the position or projection of the chin. It's a little bit like looking at the cheekbones when we do facial analysis, or looking at the nose, or looking at the bony brows. We have to go one layer deeper. And sometimes we affect actually what the jaw is like. There are a number of ways we can affect the chin. We can augment it a number of ways by doing fat grafting. We can actually introduce fat to the chin to bring it forward, make it stronger. We can do an implant, a silastic implant, to give more volume and projection to the chin. And sometimes we actually bring the bone forward itself. That's called a bony genioplasty. And that can be a very profound effect on someone's appearance. And as I said, it's the chin line, jawline, neckline that serves as the foundation for the entire rest of the face, facial beauty. So that's an introduction to the natural neck lift. Again, it's a system of analysis, looking at the anatomy, listening to a person, listening to a patient. What is it that you want to change? And we look together. And then we talk about safety and comfort and how much time off you want to take, what things cost, etc. And we can custom design an approach for you for the natural neck lift or neck rejuvenation. Why is it called plastic surgery? Sometimes people have said to me, is it because you use a lot of plastic or silicone? Is that what you call it, plastic surgery? Actually, the root of plastico in Greek is to mold, shape, and tailor. And of course, that's what we do in plastic surgery, is mold, shape, and tailor. Sometimes people come to me and they say, Dr. Morwood, you know, we're aware that you operate on children overseas and you do in this country cleft lips and palates and you take care of a lot of injuries and breast cancer and things like that. And sometimes they say, well, I feel kind of vain coming to talk to a plastic surgeon. Actually, it's normal, healthy, part of human nature to be concerned about your appearance. When we see someone on the street that's not concerned about their appearance, then we recognize that as kind of odd. Something is a kilter. So it's normal, natural, part of human nature to be concerned about your appearance. Everybody wants to look their best. It's normal and natural. And of course, the face is a very powerful tool of communication. We convey lots of emotion and send a lot of messages with our face. And of course, we can prioritize how we communicate. Some of us communicate more with our hands and body posture, etc. But the face is a very powerful tool of communication. Universally, as I said, a crisp, clean neckline and jawline serve as the foundation for a very beautiful face. Now, oftentimes, the aging signs of the neck are predictable. We can see skin lose some of its resilience, it can lose some of its sheen, the platysmal bands that you see. See here, sometimes I have people come in and they say they want a waddle-ectomy, or they want the turkey neckectomy, things like that. And they think that, doctor, can you just remove all this extra skin or tighten up my skin? When it's really the platysmal muscle, and sometimes it's fat, sometimes it's adipose tissue. So, you know, when I talk about facial rejuvenation, I spend a lot of time talking about the skin. I just want to go over this briefly. I don't want to wear people out tonight. But please be aware that when I say we accurate, or I should say effective high-quality plastic surgery starts with an accurate knowledge of the anatomy. We need to go through layer by layer. As I said, the skin, subcutaneous tissue. Fascia is something that I should mention. Fascia is the connective tissue in the body that sometimes runs along in that fatty layer. Sometimes it's on top of muscle. So oftentimes we'll say, well, we're going to tighten up a muscle. What we're really doing is tightening up fascia. Sometimes it's thick and tough like leather. Other times it's wispy and thin. It's really collagen-based. And then, as I mentioned, we look at the muscle. We look at the cartilage in the bone. As I mentioned, the foundation structures. Now, almost anyone here in this room could look at someone and almost predictively know the decade or predict or know their age within 10 years, right? Mm-hmm. So you can look at that person, and you can look at this same person 60 years later, and you know who's older and who's younger. And it's one of those things that you might not be able to exactly articulate why, but we know, it's almost inherent when we see someone. We can about predict at least a decade how long they've been alive. Now, as I said, every patient deserves a custom-designed approach. Everyone ages differently. Everyone is exposed to different amounts of sun and wind. And some of these changes we can predict exactly, and some of them, you know, we can't predict exactly. And again, take-home message, custom-designed approach. We go through the skin layer by layer, and of course, as I said, it's the epidermis is on top of the dermis. The epidermis, the very top layer of that, the keratin layer, that's not living. It's like hair and nails. And so if you see Julissa, she's going to talk how to give your skin a more attractive sheen, and actually to hydrate it, moisturize it, and get those baby cells, the factory cells in the germinal matrix really cooking and growing. Now, Chronic sun exposure, although we love the sun, most of us love the sun in California, that's why we're here, we love the sun and the wind and the outdoors. It's not great for the skin. In fact, the UV rays in the sunlight really can play havoc with the collagen and the hyaluronic acids. Now, we can actually see microscopic changes. This is kind of a busy slide. We're not going to spend too much time talking about the science of it, but I want to mention two things. Collagen is the basic protein building block in the body. And the collagen, when exposed to UV rays over years, becomes disorganized, thinned out, there's not as much there. And another thing happens. Hyaluronic acids are one of the primary molecules within our skin that holds water. So you've probably heard of Juvederm, different fillers, Restylane, etc. There's a new one called Belotero that our patients are really liking. Those are hyaluronic acids, and they're hydrophilic. That's a word from chemistry meaning they love water. So between 100 times and 1,000 times their molecular weight, they hold on to water. And as we mature and get exposed to the sun, we have less hyaluronic acids in our skin. So those types of filler actually introduce more hyaluronic acids to the skin and thereby help plump up the skin, moisturize. Now, this is a slide that shows an area of skin not exposed to a lot of sun. And this is an area in the same person, a little skin biopsy, that has been exposed to a lot of sun. Dyspigmentation, you see, you're all familiar probably with the so-called age spots, liver spots, sunspots, etc., disorganized collagen, less hyaluronic acids. What this is showing us is that we can actually do skin biopsies and scientifically analyze chronic sun exposure and the effect on the skin. And again, what we like to key in on is the collagen layer and the amount of hyaluronic acids, moisturizing, keeping the skin healthy. There are actually ways to regenerate the skin. And we can, if you want to come and talk to Julissa, she's wonderful, and we actually do a seminar on skincare and facial rejuvenation, etc. So, just very briefly, and then I think I'm going to want Danielle to come here and help me for a moment. So, skincare essentials. Number one, avoiding sun, properly cleanse, exfoliate. I talked about that, right? To get the very top layer to come off and turn over. Restoration. What we want to do is encourage that germinal matrix, that layer, the factory that makes the baby cells to get turned on. I do want to remind you that it takes about 30 days for a baby cell to get from the germinal matrix to the top so you can even tell. 30 days, and that's sort of one shedding, one layer. So when people come to the office and they say, you know, I tried skincare for a couple of weeks and I don't really see a difference. Well, you haven't even given yourself one shedding layer, because as I said, it takes 30, sometimes 40 days for those baby cells to get from the germinal matrix to where you can see them. So just imagine if you hang in there for 6 months and you allow your skin to go through that turnover process 6 times. It can really help. Moisturizing is very important. As I said, some people feel they have wrinkly, worn out skin, and it's really just dry skin. And of course, avoiding smoking. If we can do 2 things, even before you come in the office, is avoid smoking and avoid direct sun exposure. So the Fitzpatrick classification, if you come in and talk to Julissa, or if you see a dermatologist or a plastic surgeon and you're interested in any kind of skin rejuvenation, you're likely to be classified according to the Fitzpatrick scale. What that is 1 through 6. Number 1 are those people from very northern Scandinavia, blonde, blue-eyed, some redheads. They never tan, but they only burn. All the way to number 6, very dark brown or very black skin from African origins. And most people are somewhere in between, 2 through 5. But just keep in mind that your Fitzpatrick classification can really help us design the proper skincare program for you. Okay, so what are some simple ways to help with the appearance of the neck and to improve what we call the cervical mental angle? Cervical mental angle. The mentum is this. Remember from that famous Rodin sculptor, the thinker? This is called the mentum in Latin. So the cervical mental angle. So we talked about the skin. Skin's very important. Let's talk about another minimally invasive way. When people have early platysmal bands, Botox can be effective here. Now, how does that work? Well, Botox is effective for early platysmal bands. Here's a gal before and after, about 2 weeks after Botox injection. When that muscle gets tight, it's like a tightrope stringing across two skyscrapers. We get it to relax, which is what Botox does, and it can fall back. Okay, so for people with early platysmal bands or minimal platysmal bands, some Botox done right here in the office can help improve the cervical mental angle. Now, you may have heard about or read about large volume Botox injection into the platysmal muscle for significant platysmal bands. That can be effective, but what we need to do is pay attention to safety. In my office, of course, we're pledged to not only high quality, but to safety as well. So, relatively larger volumes of Botox can really affect the platysmal muscle. We have to be careful not to use too much because there are some important muscles in the area that help us to maintain our airway and speak, etc. It's temporary. Botox lasts 4 to 5 months-ish, and it tends to get expensive because we need a fair amount of the Botox. But for someone, say, who wants an effective treatment for some platysmal bands and they're willing to have Botox injections, it can be effective, but of course it's temporary. Sometimes I see people who say, you know, my daughter's wedding is in a month and I don't really want to have an operation, but I'm trying to improve these bands. That's probably a good person to come in for a few times because we want to spread out the doses of the Botox to help with the sort of an injectable platysmoplasty. So there's an example. Let me back up. So you see there she is with mild platysmal bands, and there she is about 2 weeks later. So Danielle, can she come and help me again? So we talked about skin, then we talked about injectables, right? Now, before I go on, Danielle, can we go to the liposuction part? Thank you. Botox is a muscle relaxer. I really like it for the upper third of the face around the eyes. I think it really works very well. Even though it's temporary, what we find is that if a person has the Botox done 3 or 4 times, then they need less, and they need it less often, because those muscles don't recover to their original strength. Botox is different from fillers. Things like Juvederm, Restylane, Belotero, you've probably heard of, like collagen. Those are volumizers. That's one of the ways that we can introduce volume, volume to a person, and that's with filler. The other way is with a person's own fat. And of course we can talk about that for an hour by itself. What we do with fat grafting, as I talked about for a chin advancement, for example, we can do conservative liposuction somewhere. We can decant the fat or spin it down, concentrate it, keep it clean, and then we can inject it to other places, like the cheekbone, chin, mandibular angles. This morning I did 2 breasts that way, increase the volume and fullness. Sometimes we can do the buttocks, etc. For people who have had injuries or unsatisfactory treatment with other types of modalities, we can do fat grafting. So it actually works. It replaces volume. It actually brings some stem cells with it and some estrogen receptors, so it's effective. So there's fillers, which is a volumizer. Fat grafting is also a volumizer. But Botox is different because Botox is a muscle relaxant. Okay? So for those platysmal bands, I didn't use a filler, I used Botox. Okay? Okay, so as I said, the natural neck lift is a system of careful analysis evaluating appearance, anatomy, and goals with a custom designed approach. Okay? I think that's a take-home lesson. This is not one of those offices where you get in line and everybody gets the same thing. Custom designed approach. As I said, we go through layer by layer. Got to. Okay, now, the neck has a fatty layer. What we approach with liposuction is that layer of fat underneath the skin. If I want to get the subplatysmal fat, I want to look at that, even with fiber optic instruments and a short incision. So I can do liposuction for the subcutaneous fat, but the subplatysmal fat I want to see. Again, there are salivary glands, important nerves, vessels, etc. So, what about doing the natural neck lift with liposuction. First of all, how do I do that? I make a little incision in the submental crease, and I make a little incision on each cheek where the earlobe meets the cheek. So at this little crease here. A tiny incision here and here and here. So 3 different incisions. And I put in a cannula. A cannula is a tube. And I attach it to vacuum, or I do it manually. I can create some suction, and we vacuum out fat. Now, it's more than just hooking up suction. It's more than just hooking up to a suction machine or a laser probe and plugging it in. That's not for this office. In this office, it's me and my hands, and I'm feeling and molding and shaping and tailoring as we do that. There are different treatments that you can hear about on the internet to melt fat or zap fat or heat fat or etc. And some of those things they put in a probe or a cannula and turn on the machine and come back 20 minutes later. This is molding, shaping, and tailoring. Another time I can talk about the history, but essentially the first time it was done in France that we know of by a gynecologist who used a sharp curette. Now we use a blunt curette, of course, and multiple holes. And what we do is go after that fatty layer, the subcutaneous fatty layer in between the skin and the muscles. We pass the cannula back and forth. I like to do something called the super wet technique, where even in the office or the operating room, I put in lots of very, very dilute local anesthetic with epinephrine, and it constricts the vessels and allows us to mold and shape and tailor. So essentially what we're doing is bringing the skin closer to the muscle. Now that's an important concept, because before we decide if liposuction will be effective for you, we need to look at the skin and we need to look at the muscle. So if your skin is very loose and we do liposuction, you're still going to have loose skin. And I'm going to show you lots of examples. Now, what are common areas of liposuction for women? The submentum, we're talking about that. Axillary pectoral folds in the waist and outer thighs. My staff won't let me use that term saddlebags, but that's what some people call it. Men, submentum, lower flanks. I guess it's okay to use the term love handles for the abdomen. And it's effective, it works for the right person and the right candidate. For example, here's a woman who wanted improvement in the contour of her neck. Good skin, resilience, but she has extra fat. So, liposuction only. That's the natural neck lift for her. It also works for guys. You can see that little sort of chubby area in the submentum. Liposuction only. Here's another gal who has a little bit of loose skin, but she just wanted some conservative treatment. Liposuction there. Another guy. Now notice that these people have resilient skin, right? There's not lots of loose skin or not lots of crepey skin. Liposuction only, 3 little incisions, one underneath, one where the earlobe meets the cheek on each side. Now, I want to show this case because here's a guy who came in and he didn't want a big operation. He said, I know I have extra skin. I don't want to have a big operation. I want to see if liposuction will do something for me. I said, we can get a minimal amount of improvement. You're still going to have some extra skin. And he said, okay. So he knew about it. But I just want you to know that if you have some extra skin, then we have to address that. Either we have to remove it or firm it or tighten it up. If we don't do anything, then you're still going to have some extra skin. Now, will liposuction work for me? What we have to do is look at the surrounding tissues. Here's a gal who doesn't have loose muscle. She's got a little bit of extra skin. She had the submental liposuction, cervical liposuction. Good improvement in the contour, but you see she's got a little bit of extra skin. So realistic expectations, custom designed approach. Now, here's a gal, a little, sometimes, that little bit of sort of chunky appearance, a little bit of baby fat, 3 little incisions, liposuction in the office, and there you go. Okay? Starting to get the idea? Now, what about when there is extra skin? If there's extra skin, we need to talk about that first of all. Then we need to either reposition it, firm it, tighten it up, remove it, etc. What I do want you to know is I'm very conservative when I do facial rejuvenation in terms of tightening, because I don't want people to look overstretched to the face.
Like Phyllis Diller or...
Oh, I didn't do that. But for the neck, a crisp, clean, firm neckline is attractive in both men and women. So I think that my approach to the natural neck lift is a little bit different, customized than my approach to facial rejuvenation. So, lots of different ways we can address the skin. Now, what I like to do, first of all, you're welcome to schedule a consultation. The gals can tell you about that. I think they're offering some sort of courtesy. What I like to do is to have people bring in photographs from the 20s, 30s, 40s, 50s, etc. So we can sit together and look at the fat compartments, look how people have matured, etc. So, here's a gal who brought in a photograph. Here she is about, presto changeo. Here she is about 50 years later. So, now, I want people to start to get a handle on how we do this type of analysis. Okay? So, what if I did liposuction only on her? We'd have an unhappy category patient. What we want is happy patients, right? We want people to say, I really like this. I'm going to tell my friends. So, she needed her skin addressed, right? So at times we do conservative liposuction or lipectomy. When I make an incision in the submental crease, I can sculpt the fat, remove some fat, but liposuction for her alone would not have been a happy candidate. Here is a good-looking gal with a little bit of baby fat, a little bit of extra skin, so that skin needs to be addressed. Okay, with a clean, crisp neckline, can be very attractive.
I know.
Here,
She's so pretty.
she is pretty. Now here's another gal.
That's right.
Here's another gal with some early signs of early laxity of the skin. And if I had done liposuction only for her, I think that would have been ineffective. So we need to tighten the skin, remove some skin, etc. Now, here's a gal. You can tell this isn't exactly a medical photograph. Her husband took it. And so I'm showing the before and after that her husband took, just to show the difference. Okay, are you starting to get the idea? Liposuction can effectively remove fat, but we need to look at the skin layer. Okay? When a person has loose skin, we need to address that, or at least talk about it. Sometimes people come in and they say, let's give the liposuction a try. You know, and see how I like it. We can always do a follow-up procedure, oftentimes in the office in 6 months, etc. Okay, so again, if I had done liposuction alone for her, probably would not be a happy patient, but there is a skin lift, skin tightening procedure, okay? And I do that with very different incisions. Oftentimes, I'll make an incision underneath the chin and that submental crease, right? About 90% of Americans I meet already have a scar there. I fell off my bike, my little brother pushed me off the curb, I fell down the stairs, etc. There's many times a scar there, and it heals very well anyway. So that's one approach, the submental approach. Then around the ears, we all have a crease where the ear kind of meets the cheek. I like that, and then I can go into the back, under and around the earlobe to the crease and back of the ear. Typically, those incisions tend to be very acceptable, oftentimes hard to find. Your hairdresser will always be able to find them. She goes behind there, etc. So, I talked about topical skin treatments. I talked a little bit about Botox. I've talked about liposuction. I've talked about addressing the skin. Now, let's go one layer deeper. As you recall, I talked about horses and the platysmoplasty. Look at that long mandible of the horse, and that platysma goes 3/4 of the way down the body. Now, for us, if the platysma muscle is loose, then we have to at least talk about it, a platysmoplasty. We have to affect the platysma. So, I talked about different approaches to it. I can come from the side through these incisions around the ears. I can get to it through a submental crease incision. Sometimes I do a Z-plasty, sometimes I do a division, sometimes I tighten it up with sutures. Really, part of the take-home message is custom designed approach, right? But keep in mind, there's a platysmoplasty if the platysma is loose. So we can tighten it up, firm it up. Now, I want to show you some examples. Here's a gal with a little bit of extra skin, a little bit, but her primary issue is a lax platysma. So what does she get in addition to very conservative lipectomy, right? Removing a little bit of fat, transposing the fat around, tightening up the skin. She gets a platysmoplasty. Okay, starting to get the idea?
Yeah.
Now, here's a gal with quite profound laxity of her platysma muscle. If I did liposuction only for her, unhappy category. If I did skin tightening only, it might last for 6 weeks. But if we address the issue, instead of just masking the problem, well then, she gets a much more longer lasting result, an effective result, okay? You see the difference with that? Here's a gal with a little bit of extra skin, a little bit of loose muscle. Okay, so I don't want to bore you. Here's a gal again, brought in the pictures, and then I look at her. Now, oftentimes I look at the lower third of the face as a unit, the neck and the jowls. People I think know what the jowls are, right? Sort of at the bottom of the marionette lines, those are jowls. I oftentimes will address the neck and jowls together. It doesn't have to be that way, but typically we address them as a unit. So here's a gal who wanted something done in the office, and we can talk about that another time. So that's, she got a neck and jowl lift. Here's a gal with a little bit of extra skin, so platysmoplasty alone would not be good for her. We need to address both. If you look at this gal, you can almost say to yourself, she's lost volume. Think of that balloon, that little balloon that's had some air. So a little bit of revolumization, conservative skin firming and tightening, that really helps give a more natural look. And of course, every customer deserves a custom designed approach. Here's a gal with some early jowls, some laxity in the neck. She wanted something done in the office. Neck and jowl lift. Here's a gal who, and I'm sure this is about to advance any moment. There we go. So she brought in some photos of some modeling. She's got with a little bit of laxity. And in the office, we can help firm up the skin. So I'm showing you lots of different cases. I hope you get the idea. Custom designed approach. Now, what about a direct neck lift? Sometimes people will come in and they say they want the most simple operation possible. They don't care about scars, and they grab this tissue underneath and they say, "Doc, I just want you to cut this out." There's actually an operation for that. It's called a direct neck lift, but you do get a scar. It can be very effective. It can be done in the office. It doesn't take a lot of time, but we go from there to there. That's a direct neck lift, a direct excision. Sometimes people don't mind telling their friends why they have a scar. Other times they may say, "Oh, I had a tracheostomy," or "I had my thyroid out," or whatever. It doesn't matter. But it can be very effective. Loose skin, direct neck lift, etc. Here's another gal who said she wanted something kind of short, so she had a direct neck lift. Okay, so those are relatively conservative approaches. Now, what about the kind of classic approach to the neck and jowl lift, especially when someone wants some facial rejuvenation along with the neck and jowl lift? Oh, and by the way, when we do a custom designed approach, we're in the era where you can have done what components you want. People come in, they say, "I just want my cheeks, I just want my eyelids, I just want neck and jowls, I just want my lateral brow done," etc. So we can custom design an approach for you. So here's a gal who, yes, wanted some neck and jowl elevation, but she also wanted some facial rejuvenation. The incision, the length of the incision varies dramatically from patient to patient. If I just need to gain access to get into deeper tissues, it's typically a short incision, and I use fiber optic instruments and magnification. But if I need to remove lots of skin, or tighten lots of skin by removing, well then there's a longer incision. So here's a gal who had a more classical approach to go to there. Neck, jowl, and more face. Here's a gal who had some neck rejuvenation along with the facial rejuvenation. And again, she had the platysmoplasty and lipectomy and some skin tightening, etc. So I don't want to bore you, but I just want you to know that the neck and jowl lift can be done with more facial rejuvenation, etc. Custom designed approach. Okay, so I think what I'm going to, can we hang in there for just a few more minutes? Because we're going to round third base. This is just not for women, of course. A crisp, clean neckline in men can be very effective. It's the foundation for good looks. That's from my favorite sculptor, Rodin. So I like to look at photographs kind of through the years. Good, strong jaw guy, nice neck, handsome dude. and over the years has just lost volume, a little less resilience in the skin, some laxity. So to improve the neck and jowls, I think really serves as a really strong foundation for the rest of the face. And of course from the side, oftentimes, sometimes I have people come in and they say they never realized that they wanted a neck lift until they saw themselves in wedding photos or they saw themselves on TV, etc. So it can be very effective for men as well. And I think I'm probably doing more neck lifts for men than facelifts. And more women want neck lifts as well, whether it's with the face or without. Again, sometimes guys don't want their face touched, but they do want some neck rejuvenation. Okay, so here, and now, this next one is a guy who needed, for one, it's a little more revolumization. So if you can kind of remember this, and then when you see his post-operative picture, see how he's a little more revolumized, I don't think overdone. But he's a little, almost like his face is a little bit wider, the jaw is a little more wider. So facial rejuvenation, volumetric rejuvenation from the side. He looks a little deflated. And here's another case of a guy, just a little extra skin, we do some conservative repositioning, etc. So, just very briefly, there's 3 places that we do operations. Here in the office, we do things with oral sedation. We don't put people to sleep. We don't start an IV in the office. That's for people who can tolerate it. The next step is to go to the surgery center. I'm very lucky that there's a surgery center right downstairs. People can have an IV started. They can take a nap or just get heavily sedated. I'm chief of the division at the hospital. We can go to the hospital. You can be put to sleep or get a heavy anesthetic, whatever you want. So there's 3 levels of or I should say 3 locations, office, surgery center, or hospital. Now, I just want to show a few cases before we take a break and see if there's questions and we can all get a little beverage and treat. I talked about the foundation, right? So we've talked about skin treatments. We talked about adjusting the skin. I talked about the fatty layer. I talked about the muscle underneath. I can also go after that subplatysmal fat. What about the foundation? Well, here's a guy who has really good skin. He's got some extra fat, but when you look at him, you could guess that his chin is a little weak. So, through a little incision, as I said, 3 tiny incisions, one in the submental crease, one at each earlobe where it meets the cheek, and then an incision inside, in the mouth, I can bring his chin forward, and so we go to there. And for that guy, you know, it's just a much more stronger, masculine, kind of alert, ready look for a guy to have. And it's good for some women too. Just bring the chin forward conservatively, can improve the neckline. This gal came in and said, it's the first time I ever felt comfortable wearing pearls and a beautiful necklace. Here's a gal who has almost no cervical mental angle. Here she is just healing. Here's another time where we did a little, I think we did a little fat grafting for her chin to bring it forward. Here's a gal, good looking girl who thought she wanted an aggressive nose reshaping or rhinoplasty. I said, let's be conservative, but let's address the skin and a little fat and bring your chin forward as well. So, those are just examples of where I go to the foundation. And again, a well-informed patient, we want to be a relaxed patient. I talked about in-office procedures. I talked about the surgery center, hospital. Very briefly, I'm going to show 2 more slides and then we're going to take a break. People come in and they say, of course, people want to know, what about activities after surgery? Everybody's got to rest and take it easy for 3 days and 3 nights. Doesn't mean lay in bed, but it means take it easy. 3 days and 3 nights. On day number 4, a little more activity, but don't get your blood pressure up. Walking's great. Light elliptical strider, light stationary bike. Walking's great, but no powerlifting, no jogging really on day 4. On day 11, slowly get back to your life. Depending upon what we do, skin resurfacing, fat grafting, I tell people that they can go to a dinner party in about 2 weeks. Lots of people on day 4 go to a desk and do paperwork, telephone work, etc. But for everybody, 3 days and 3 nights of rest and taking it easy at home. It's your time to watch classic movies or listen to your favorite Beatles records or something like that. Now, complications in plastic surgery, of course, hematomas, bleeding, bad scars, tissue loss, infection, wound dehiscence means incisions can come apart, nerve problems, uneven results, imperfect result, possible need or desire for further surgery. And of course, the factors influencing your results and the treatment operation selected, that's really key. Your inherent healing ability. I tell people that I can make the incision, I can do the operation, but I can't make your scar. You make the scar. Some people make scars that are almost invisible. Other people make scars almost like ropes. Compliance, got to follow directions. Surgeon skill, of course, and your preoperative appearance and condition.